Hello everyone. Today I want to practice about the reading. This topic today I want to practice about the Circular 28 2025 about the prescribing good manufacturing practice for the pharmaceuticals products and pharmaceutical starting material. Article 1 scope. The circular provides for the application and promulgation of the principle and standard of the good manufacturing practices for the pharmaceutical products and pharmaceutical starting material and inspection of the maintenance of the GMP compliance. Article 2 definition. For the purpose of this circular, the terms below shall be construed as follows. Good manufacturing practice for the pharmaceutical products and pharmaceutical starting material, hereafter referred to as the GMP, means a set of the principle and standard of the manufacture of the pharmaceutical products and pharmaceutical starting material to ensure that pharmaceutical products and pharmaceutical starting material are consistently manufactured and controlled to the quality standard appropriate to their intended use and as required by the marketing authorization of the pharmaceutical products and pharmaceutical starting materials. Manufacture, including manufacture of the chemical pharmaceutical products, herbal pharmaceutical products, vaccines, biological, traditional pharmaceutical products, prepare traditional pharmaceutical materials, pharmaceutical starting materials, herbal materials meant an establishment engaged in the pharmaceutical activity that is required or not required to obtain certificate of satisfaction of the condition for the pharmaceutical business. That covers one, some or all the stages of the process of the manufacturing pharmaceutical products and pharmaceutical starting material. Deficiency means deviation from the GMP principle and standards, hereafter referred to as the GMP principles or on other applicable regulation or law on the pharmacist management. GMP standard for good manufacturing practices and it translated as the conduct sản xuất thuốc in Vietnamese. WHO standards for World Health Organization and translated as Tổ chức Y tế Thế giới in Vietnamese. BIC/S standards for pharmaceutical inspection cooperation scheme and is translated as hệ thống hợp tác thanh tra dược phẩm in Vietnamese. PICS GMP means good manufacturing practice for the pharmaceutical inspection cooperation scheme. EU or GMP stands for European Union and is translated as the Liên minh châu Âu is the Vietnamese. EU GMP means good manufacturing practice for practice of European Unions US stands for United States and translated as Hoa Kỳ in the Vietnamese. SRA stands for Stringent Regulatory Agency and is translated as the cơ quan quản lý dược nghiêm ngặt in the Vietnamese as defined by WHO. Equivalence to EU GMP means GMP principle issued by the drug regulatories authorities of the SRA countries. Type 2 declaration of the application of the good manufacturing practice for the pharmaceutical products and pharmaceuticals studied materials. The application of the following GMP principle shall be declared. WHO GMP principles provided in the Appendix 1 in this circular and updated documents specified in Clause 4 of this article. Principle of the WHO GMP for biological medicinal products derived from the human blood and human plasma provided in the Appendix 2 to this circular and updated documents specified in Clause 4 of this circular. GMP principle of the pharmaceutical inspection cooperation scheme provided in the Appendix 3 to this circular and updated documents specified in Clause 4 of this circular. GMP principle provide the Appendix 4 of this circular and updated document specified in Clause 4 of this circular. The following GMP principles shall be promulgated. Principle of the GMP for the herbal pharmaceutical products provided in the Appendix 5 to this circular. Principle of the GMP for the traditional pharmaceutical products provided in the Appendix 4. In the Appendix 6 to this circular. Principle of the GMP for prepared traditional medicinal material provided in the Appendix 7 to this circular. For manufacture of the pharmaceutical products and pharmaceutical studied material older than excipients, in addition to the GMP principle specified Clause 1 and 2 of this circular, all the GMP principles and apply include. GMP principle provide equivalent to EU GMP principle issued by the Drug Regulatory Authorization of the SRA country, which are permitted to the applied manufacture of the pharmaceutical products and pharmaceutical starting material, and that apply these GMP principles shall send English version issued by the SRA to the Drug Administration of the Vietnam, so that they are uploaded to its website and the web portal of the Ministry of Health of Vietnam. GMP principle assessment and recognized by the Ministry of Health to be conformable with the GMP principle or declared to apply as prescribed in point C, Clause 1, Article 97 of the Decree number 163/22 over 2025 government decree date June 28, 2020, 29, 2025 on elaboration of the some article and measure to organize and provide guidance on the implementation of the law on the pharmacist, hereafter referred to as the decree number 163 2025 government decree, which are used for inspection of the GMP compliance and of manufacture of the manufacturer pharmaceutical products and pharmaceutical starting material upon marketing authorization of the pharmaceutical products and pharmaceutical starting material is the Vietnam. For manufacturers of the manufacturer, B for manufacturers of the pharmaceutical products being excipients. In addition to the GMP principle mentioned in the point D, clause 1 of this circular, manufacturers of the excipients are entitled to apply other GMP principle of the International Pharmaceutical Excipients Council IPEC of the certification scheme for the pharmaceutical expedient. American National Standard Institute or ANSI, United States Pharmaceutical USP, Pharmacopoeia, right? Pharmacopoeia. USP of other principle for the manufacturer experience applied by the regulatory authorities of the countries or another international organization related to excipient used to manufacture pharmaceutical products, cosmetics, and foods. Updated document on GMP principle. If WHO may make any revision to GMP principle, hereafter prefer to ask the updated document specified in point A and B, clause 1 of this circular, within 3 months from the date on which the updated documents are published on the WHO web portal. The Drug Administration of the Vietnam or the Traditional Medicine Administration of the Vietnam shall, according to the assigned view of the state management, publish content of the updated documents or retrieval updating and application by relevant entities, translate such documents and publish Vietnamese translations or preference on the web portal of the Ministry of Health of the Vietnam and a website of the Drug Administration of Vietnam or Traditional Medicine Administration of Vietnam. If the Pharmaceutical Inspection Cooperation System (PIC) OS or the European Union has the updated documents specified in point C and D, clause 1 of this circular, which have not been published on the web portal. The Ministry of Health of the Vietnam and website of the drug material applying such a document shall send the English version to the Drug Administration Vietnam, within 10 days from date of receipt. The drug administration of the Vietnam shall publish in English version on the web portal of the Ministry of Health of the Vietnam and the website the Drug Administration Vietnam for retrieval, updating and application by relevant entities. Manufacture of the pharmaceutical products and manufacture and pharmaceutical manufacturers of the pharmaceutical products and pharmaceutical starting material, except for the biological pharmaceutical products and pharmaceutical starting material retrieved from the human blood and human plasma, shall apply GMP principles specified in Appendix 1 or Appendix 3 or Appendix 4 of this circular and updated documents specified in Clause 4, Article 3 of this circular. Manufacturers of biological pharmaceutical products derived from the human blood and human plasma shall apply GMP principle specified of the Appendix 2 of this circular and updated documents specified in Clause 4, Article 3 of this circular. Manufacture of prepared traditional medicinal materials shall apply GMP principle specified in the Appendix 6 of this circular. Manufacturer of the traditional pharmaceutical products that only manufactures traditional pharmaceutical products in the form of the extraction, pure pellet, powder, medicine liquid, or the tincture. Shall we apply tincture on it? Tinctures shall apply GMP principle specified in Part 1, Appendix 6 of this circular. Manufacturers of traditional pharmaceutical products in model dosage from capsule, tablet, granule, liquid medicine, and other model dosage from another dose specified in Clause 4 of this article shall apply GMP principle specified in Part 2 Appendix 4 in this circular. Manufacture of prepared traditional medicinal materials shall apply GMP principle specified in Appendix 7 to this circular. Manufacture of the pharmaceutical products and pharmaceutical starting material may apply another GMP principles and equivalents to EU GMP principle issued by drug regulatory authorities of the SRA country and updated documents specified in Clause 4, Article 3 of this circular. Manufacture of the herbal pharmaceutical products, traditional pharmaceutical products, and prepared traditional medicine material shall apply GMP principle specified in the Appendix 1 of Appendix 3 and Appendix 4 to this circular and updated documents specified in Clause 4, Article 3 of this circular. Manufacture of the traditional pharmaceutical products and prepared traditional pharmaceutical material are permitted to apply GMP. Apply GMP. Specified apply GMP. First, apply GMP. Applied for traditional remedies updated document specified for fight applied now then. Applied and prepare shall be GMP spiral. For um, in addition to being manufactured by the manufacturer applying a corresponding GMP principle specified in the article. In this article, pharmaceutical products and pharmaceutical starting material containing beta-lactams, antibiotics, penicillin, cephalosporins, penance, and equivalent cytotoxics, contraceptive, sex hormone, vaccines, biologicals containing live microorganisms. A specific principle a specific manufacturer's products subject to prepare manufacturing requirements specified in GMP principle W80 GMP PIC over S GMP EU GMP and G this European errors and error equivalent must be manufactured on prepare on separate lines, separate facilities, and manufacturer equivalent and measures should be in place to prevent the release of such pharmaceutical products and environmental contamination and another pharmaceutical products and pharmaceutical manufacturers in the same area. For anti-cancer sex hormone and highly active pharmaceutical ingredients and is ingredients that do not belong to the above group pharmaceutical products and necessities and level of separation of the facility and or manufacturing equivalent shall be determined on the basis of the risk assessment and guidelines of the European Medicine Agency EMA or WHO. The pharmaceutical products and pharmaceutical studied in materials specified in point A and B of these clothes which are manufactured by the manufacturer are in the foreign countries described in the point B, Clause 1 Article 94 of the decree number 163 2025 government decree granted the marketing authorization or the certificate of the pharmaceutical product CPP by the regulatory authorities of these foreign country shall be recognized to be covered by the GMP certification without being required to be manufactured on the separate line and may be declared to fall within the scope of the manufacturer expected manufacture operation according to the provision of Article 60 of this circular. Manufacture of chemical pharmaceutical products, including those described by over-the-counter OTC chemical pharmaceutical products which have a production line capable of the producing soft production capable producing soft capsule, oral equip and external medicine cream, gels, ointment, and topical liquids are entitled to manufacture description and OTC chemical pharmaceutical products and herbal pharmaceutical products from the herbal extract glue, granule, herbal powder, and essential oil, which have been standardized on the production line capable of the producing equivalent dosage form, which have been standardized on the production line capable of the production equivalent dosage form. The manufacturer must apply GMP principle specified in the appendix 1 or appendix 3 or appendix 6, appendix 4, 3, appendix 4 to the circular and updated a document specified in Clause 4, Article 3 of this circular. The manufacturers that only manufacture OTC chemical pharmaceutical products are entitled to manufacture herbal pharmaceutical products, traditional pharmaceutical products, and dietary supplements which have a dosage form equivalent to those sanctified. The manufacturers must apply the GMP principle specified in the appendix 1 or appendix 3 or appendix 3 of this circular and updated documents specified in Clause 4, Article 3 of this circular. Manufacturers of herbal pharmaceutical products are entitled to manufacture herbal pharmaceutical products with pure ingredients extracted from the essential oils, vitamins, and minerals, and must apply GMP principles specified in the appendix 5 to this circular. Manufacturers of the traditional pharmaceutical products are entitled to manufacture traditional pharmaceutical products with added pure ingredients extracted from essential oils to vitamin mineral, and must apply GMP principles specified in appendix 6 to this circular. Manufacturers of herbal pharmaceutical products, semi-finished pharmaceutical products in the form of pasta, granule, powder, extract, essential oil, resin, gum, jelly, and allowed to the manufacturers materials and semi-finished dietary supplements which have a dosage form equivalent to the certificate and must apply corresponding GMP principle specified in Clause 8 and 9 of this article. 16. Manufacturers entitling one or some stage of the process of the manufacturer's pharmaceutical products and pharmaceutical standard materials shall apply and comply with the corresponding GMP principles suitable for the stage of the manufacturer's pharmaceutical products and pharmaceutical standard material and mentioned in Clause 1 through 10 in this circular. Manufacture of pharmaceutical products and pharmaceutical standard material shall apply updated GMP document specified in Clause 4, Article 3 hereof within 12 months in case of any change of facilities or the manufacturer's equivalent from the date on which updated documents are published on the web portal of the Ministry of Health of the Vietnam and the website of the Drug Administration of the Vietnam. 6 months in case of update other than the specified in point 8 of this clause from the date on which updated documents are published on the web portal on the Ministry of Health of the Vietnam and the website of the Drug Administration of the Vietnam. Manufacture of the pharmaceutical standard material being excipient shall apply GMP principle and comply with the regulation laid out in Part 4 in the appendix 1 to this circular or the GMP or Clause 4 Article 3 of this circular in case W80 IPEC EXCI Pact and USP are another international organization relevant to excipient used for the manufacture of germ cosmetics. Food have the public updated to their GMP principle to the manufacturer starting material being excipient. Hereafter prefers to ask the updated document on their website. Manufacturer of pharmaceutical starting material being excipient shall apply the updated document within 20 months of case any change facility or manufacture equipment from the date on which updated documents are published. 6 months in case the updated another than those specified in point A of this clause from the date on which updated documents are published. Okay, today I practice a chapter 2. Okay.